Hello seedlings, this is Dicot Medical, and today we are going to be discussing pharmacology. What is pharmacology? Pharmacology is the study of drugs. Pharmacology is the study of the preparation, effects, and side effects of drugs. What is a drug? A drug is a chemical substance that functions to either treat or cure an ailment or disease. What is the difference between treat and cure? Treat means management of a disease, management of symptoms of a disease. For example, I take paracetamol to treat my headache. What is a cure? A cure is a drug or a chemical substance that completely eradicates a disease. For example, the polio vaccine is taken to completely prevent polio. The difference between the two is that in treatment, drugs are used to manage a disease or symptoms of that disease, while in cure, drug is used to completely eradicate that disease. It is important for us to study drugs so that we can understand how these drugs have effects on each and every one of us, on our systems. It is very important that you pay attention to the foundation of pharmacology, because everything about the systemic pharmacology, where you learn about the drugs pertaining to each and every system, from the cardiovascular system to the nervous system. And it is very important in research pharmacology, where we understand how to chemically prepare and produce drugs, how to fashion them to take care or to completely eradicate or to treat particular diseases that arise. Pharmacology is divided into pharmacokinetics and pharmacodynamics. But for the purpose of this video, we will be starting with pharmacokinetics. What is pharmacokinetics? Pharmacokinetics is the study of how a drug moves in, through, and out the body. Pharmacokinetics. Now, pharmacokinetics is the study of the movement of drug in the body. And what does that mean? It means how the drugs come in the body, how the drugs move through the body, and how the drugs move out of the body. When we're trying to understand how drugs move in the body, we study the routes of administration. That is how drugs can get in the body. Routes of administration. And then we study the transport of drug. Routes of administration and transport of drugs. When we talk about how drugs move through the body, we discuss absorption, and distribution. And when we discuss how drugs move out of the body, we talk about metabolism and excretion. In the video, or in today's video, we're only going to be talking about how drugs move in the body, or how they get in the body. And that is via routes of administration and transport across the different membranes, or transport in the body system. Now, routes of administration are the different ways, or the different entry points in the human body for drugs to pass through the physical biological barrier and get into the biological system. There are many different routes of administration, but we'll be classifying them under enteral and parenteral. Enteral means the routes of administration that are associated or that pass through the gastrointestinal tract, while parenteral concerns the routes of administration that bypass the gastrointestinal system. This is also parenteral. Okay. Now when we talk about the routes of administration that are involved or that are related to the enteral or the gastrointestinal system, the first on our list is going to be oral administration. So this is a mouth. First would be oral administration. Now, oral administration simply means taking in drugs either in capsule form, liquid form, or powdered form through the mouth or in the mouth to be swallowed into the stomach. Now, what are the advantages of this oral system, of this oral part? Number one advantage is that it is very common. Okay, most of the prescribed drugs that patients take out of the hospital are orally administered drugs. So they are common, they are inexpensive, that is, they are non-expensive. They are common, they are inexpensive, they are non-invasive. Non-invasive means that they don't involve pain and they don't involve getting directly into the body system. Now, some of the disadvantages of the oral route of administration is first-pass metabolism. What is first-pass metabolism? First-pass metabolism is a process by which a drug ingested into the gastrointestinal system is firstly metabolized by the liver before it reaches the small intestine for absorption for the body. As you can tell, it means that some part or some concentration of the drug is lost in the process of first-pass metabolism. What does that mean? First-pass metabolism will cause a decrease in the bioavailability of a drug. Another disadvantage of the oral route of administration is that it is not useful or cannot be used in comatose patients. That is, patients that are in a coma. This is because oral administration or oral route of administration involves swallowing. So it cannot be used for an unconscious patient and it cannot be used for a patient in coma. Another disadvantage of this route of administration is that it will not produce immediate effect. As discussed, first-pass metabolism takes place. What does this mean? This means that the bioavailability will be reduced and also the time to reach systemic circulation will be reduced. So it cannot be used in emergency situations. Next, we will go to another enteral route, which is going to be the sublingual route. This is the tongue. And then the sublingual route will be underneath the tongue. Sublingual. So sublingual route is drugs that are administered under the tongue, either as sprays or as tablets to be dissolved under the tongue. An example is nitroglycerin. Now, what are the advantages of this route of administration? Number one, it bypasses the first-pass metabolism because the drug would diffuse into the oral mucosa. Okay, so it is not being swallowed to enter the stomach, the gastrointestinal system, and then to be metabolized by the liver. So it bypasses the first-pass metabolism. Okay. Number two, it is also not destroyed by the stomach acid since it is bypassing first-pass metabolism. Since it is bypassing first-pass metabolism, number three, it is going to reach systemic circulation faster because drugs in the sublingual or drugs administered via the sublingual route, okay, once they enter the bloodstream, they drain into the superior vena cava. They go into the superior vena cava and that's direct passage or direct entry into the heart. So they are able to distribute, or the distribution is able to take place much quicker than the oral route. Now, what are the disadvantages of the sublingual route? It can only be used for low doses or little doses of drugs. You cannot put 2 to 5 tablets under your tongue. Another disadvantage is that it may irritate the oral mucosa. Now let us go to the buccal administration, or the buccal route of administration. Now, the buccal route of administration is the administration of drugs in between the cheek and the teeth. The space here in between the cheek and the teeth. So a drug can be placed there for it to diffuse. What are the advantages of this route? Number one, it will bypass first-pass metabolism because it will not be swallowed into the system. And number two, it reaches the systemic circulation faster. What are the disadvantages of this drug, of this route? Number one, it is not common. Number 2, it may also irritate the oral mucosa or the buccal cavity. And number 3, it is inconvenient because one has to ensure that that particular drug stays in the mouth. Small doses. These are just characteristics. So it's given in small doses. It bypasses first pass metabolism. First pass metabolism. Okay, and for sublingual, it would also bypass first pass metabolism. It would also bypass metabolism, but it may irritate the oral mucosa, and it is also uncomfortable. Okay. Now, the final or the last enteral route of administration is the rectal route. Rectal route. Yes, this seems like a very, very uncomfortable place to administer a drug, but it is very, very useful. Now, some of the advantages of this rectal route is that, number 1, it can be used in comatose patients. Useful in comatose patients because a comatose patient cannot swallow. It is also useful when the drug is complex or is kind of irritating. So it's useful in complex drug mixtures or if the substance is irritating. Okay. And it is also useful because it will bypass first pass metabolism because it will be drained via the rectal veins. Anything that is not being swallowed by the stomach to end up in the liver to be metabolized partially will bypass first pass metabolism. First pass metabolism. Now, what are the disadvantages of the rectal route? Number 1, it is uncomfortable. And it is still not very widely accepted. In some places, it is not really accepted. Another disadvantage is that it may irritate the rectal mucosa. Okay, depending on the kind of drug, it may irritate the rectal mucosa. And lastly, presence of fecal matter would greatly reduce the bioavailability of the drug. Why is that? Because the drug will be absorbed by the fecal matter. If there is presence of fecal matter in the sigmoid colon or in the large intestine at that point in time, the fecal matter present will absorb the drug. So it will not, instead of the drug to be fully absorbed into the mucosa of the rectum, some parts of it will be absorbed by the fecal matter present, and this will greatly reduce the bioavailability of the drug. What is bioavailability? Bioavailability is the amount or percentage of a drug that reaches systemic circulation unchanged. Okay, it is that amount of drug that reaches systemic circulation unchanged that will now be able to diffuse and go to and be distributed to its site of action. We have finished discussing the enteral routes of administration. Next, we are going to be discussing the parenteral routes of administration. The first parenteral route of administration we'll be discussing would be the inhalation route. Inhalation. What is the inhalation route? Now, the inhalation route is a route of administration in which drugs are put in the form of, or in which drugs in the form of gases or suspended droplets or particles are inhaled into the lungs. Why is this even a route of administration? Because the lungs are very, very vascularized. Because the lung is the site of oxygenation of blood, it is very vascularized and there would be very close or almost immediate effects. So what are the advantages of this route of administration? Number one, the effect is immediate or almost immediate. Immediate or almost immediate. Now, due to this quality, it can be used in emergency purposes, emergency situations. Obviously, it bypasses first pass metabolism. Bypasses first pass metabolism. It is easy. It is easy just to inhale, so it can be used. It can also be used in patients with respiratory dysfunctions. So it can be used in patients with respiratory dysfunctions. Now, what are the disadvantages? It is very, very addictive, or it can cause a very serious addiction to the particular drug. Why is this? Since it would be absorbed very quickly because of its vascularization, there is also very, very serious possibility of it entering the blood vessels going to the brain. That is the internal carotid and the basal arteries. And once it gets to the brain, it's very, very possible for the individual to get addicted. So addiction is possible. Addiction is possible. Another important disadvantage of this is that the dose cannot be controlled. Since it is going to be suspended in air, or since it will be given as a gas, it is very different to ensure the needed dose is given to the patient, because some part of it can be lost in the air. Some part of it, before the mask gets on the patient, some dose of the drug or some concentration of the drug may be lost in the air. So it is difficult to control dose. Difficult dose control. Now, the next parenteral route we'll be discussing will be the intrathecal route. This route of administration is not extremely common. It's not extremely common, but it is still very useful. Now, what is the intrathecal route? The intrathecal route of administration is when a drug is injected in the subarachnoid space. Subarachnoid space is the space between the arachnoid layer of meninges and the PA layer of meninges. So what does that mean? It is injected, it's when a drug is injected directly into the spinal cord. What are the advantages of this? Why does this even exist? There are some drugs that in emergency purposes must reach the central nervous system. So it is used in emergency purposes for drugs that must reach the central nervous system very quickly. Emergency to central nervous system. Okay? And that is really basically what. So we have the dura, we have the arachnoid, and then the PA is in direct contact with the spinal cord. That is why I didn't draw it as a firm layer itself. But the subarachnoid space is between the PA matter and the arachnoid matter. Now, what is a disadvantage of this? Obviously, risk of infection. Risk of infection. Because the spinal cord is a very, 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 very delicate organ. And if this is done under septic conditions, bacteria or virus or fungi or parasites can be introduced into the spinal cord and cause meningitis. Another disadvantage of this is that it is expensive, but another disadvantage of this is that it must be done by a professional. A medical student should not do it. Done by professional, as it's a very delicate procedure. Now we have come to our superstar of the day, the intravenous route. IV, intravenous route. Intravenous route, injecting a drug into the vein of an individual. We inject drugs into veins, not arteries. We inject drugs into veins, not arteries. The intravenous route is an extremely common route of administration in the hospital for patients that have been admitted or patients that are comatose. It is very, very important because the drug would have 100% bioavailability. Why would the drug have 100% bioavailability? It is the only route of bioavailability. It is the only route of administration in which the drug goes immediately into systemic circulation. It doesn't pass any form of biological barriers. It goes immediately into systemic circulation. Therefore, it would have 100% bioavailability. It is also useful in giving large doses of a particular drug. For example, patients that are admitted into the hospital. It is useful in giving large doses of a particular drug. Now, what else? So the intravenous route can be used, or it is used in emergency situations. You know, emergency situations where the patient may not be able to swallow, where the patient may be unconscious, where the patient may be comatose, where the patient may be in pain, where the patient may be uncooperative. Intravenous route is for you. So it is used in emergency situations and all those other situations that I mentioned. Now, our big boy. What are the disadvantages of this route? Number one, it is invasive, so it's a bit painful. So it is invasive. Number two, since it is being injected, it must be done in an aseptic environment, because there will be, as long as it's being injected directly into the bloodstream, there is going to be a risk of infection. The patient may not get infected, but there will be a risk of infection. So risk of infection and another disadvantage is that you cannot administer oily substances via this way, because whatever drug or substance that you want to administer must be able to diffuse into the normal saline or into the drip being given to the patient. So cannot use oily substances, or cannot be used to administer oily substances. This is just a show of the characteristics of the intravenous route. It has 100% bioavailability. It can be given in, or it can be used to administer drugs that are needed in large doses, such as patients that have been admitted into the hospital. It can be used in emergency situations, whether the patient is unconscious, non-cooperative, whether the patient is comatose. It is an invasive measure because the biological membrane or the biological barrier of the system of the individual is going to be broken, because you will be puncturing a needle into that vessel, or you may be puncturing the needle into the bag of normal saline, but it will still get in via a needle that is inside the blood vessel already. Because of that, there is also a risk of infection. So in administration, one must be extremely careful to ensure aseptic conditions so as not to infect the patient and cause sepsis. And then it cannot be used in the administration of oily substances. We are going to talk about the three final parenteral routes of administration. As you can see, this is the diagram of the skin, or the layers of the skin. So that means that these last three routes involve the skin. So the first route would be the transdermal route of administration. Now, the transdermal route of administration is the administration of drugs on the topical layer of the skin, such as ointments or creams, to the layer or the visible layer of skin. Now, advantages of this is that it would bypass first-pass metabolism. Obviously, it would bypass the stomach acid. So the transdermal route would bypass stomach acid. It would bypass stomach acid. It would bypass first pass metabolism. Unfortunately, transdermal routes cannot be given in or cannot be used to administer drugs needed in high doses. So it cannot be used to administer drugs in high doses. But one important thing or one advantage of this route of administration is that it is very important for a drug called penicillin. Now, penicillin is very, very unstable in the stomach acid or in the environment of the stomach. So that is why the penicillin cream is applied on your body. So, penicillin. Now, another route of administration associated with the skin is the subcutaneous route. Subcutaneous, that means it is administered in the adipose layer of the skin, and that is for, it would be very, very great for drugs that are very, very lipophilic, because the adipose tissue is made up, or the adipose cells made up of fat. They are fat droplets, so it is great. So that's an advantage. It is great for the lipophilic kind of drugs, but a disadvantage is that it cannot be used for hydrophilic drugs. Okay, oil and water don't mix, so it cannot be used for hydrophilic drugs. So that is subcutaneous. So it is majorly used for lipophilic drugs, but hydrophilic drugs cannot go through it. Okay, the last route of administration, that's number 10 if you've been counting. The last route of administration is intramuscular route. This is the muscle, intramuscular or IM. Yeah, IM, intramuscular. Think. So the intramuscular route of administration, this is the route of administration, or this is the route of administration in which a drug is administered into the muscle tissue, mostly skeletal muscle. So in which drugs are administered into the muscle tissue. Now, this route of administration is great for drugs that need to diffuse laterally, and skeletal muscle is actually well vascularized. The disadvantage of this route is that obviously there is high risk of infection, because the needle is passing through so many layers, it's going deep into the muscle, so there's high risk of infection. It's painful and uncomfortable. So now that we are done with the various routes of administration, the routes of administration show us physically what we can see in a gross manner, how the drugs get into the body. Now we're going to be going down to the molecular level. How the drugs get into the body, yes, but at the molecular level. What can't we see that is going on in our body when we ingest paracetamol or acetaminophen?